Greetings, friends and followers. This is Nurses Talking. I am Del Barcy. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. So, here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, it is my very, very great pleasure to welcome Dr. Clarese Crenshaw. Dr. Crenshaw is a results-focused acute care nurse and educator, she says, with 14 plus years of direct acute care experience. And this includes trauma, emergency trauma, critical care surgery, cardiac medicine, and education. And she says her passion for clinical education and mentorship led her from the bedside to the classrooms of Monmouth University and Ramapo College as a clinical adjunct. Dr. Crenshaw has a doctorate in nursing leadership, which she says she will utilize to help grow the profession for generations to come. So, welcome, welcome, welcome.
Thank you, and good morning. I appreciate being here.
It's my pleasure. But first of all, why are you a nurse? What brought you to this?
Honestly, nursing came to me from a personal family trauma. That's by way of my sister. When I was young, about 4 years old, my sister was hit by a car, and I remember that day. Again, I'm 4, she was
Mm-hmm.
5, and she went out riding her bike without telling my mother, her and my cousin. And I remember my cousin running into the house and he sat on the couch and he just was blank face, nothing. And everyone asked him, "Hey, where's Simone at?" And he
Mm-hmm.
couldn't say anything. So when they went outside to check, they saw my sister was down the street on the ground. So
Mm-hmm.
it was, you can imagine for a 4-year-old, you're like,
Yes.
what's going on? And I remember my mom in the street wailing. And I remember the ambulance and my sister on the ground. And it was obviously very traumatic. She went to the hospital and slowly but surely she got better. But I remember spending my time in the hospital settings, in the playrooms of the hospitals, and being there frequently.
Mm-hmm.
And I started to really enjoy the environment. It's weird, I know. And although my sister had to kind of learn how to kind of walk again,
Mm-hmm.
coordination again, and she ended up in speech courses, etc. She did have to wear a helmet to prevent any further like traumas to the brain.
Yeah.
Like she had a TBI.
Mm.
So, but over time, my sister was back home. Despite
Okay.
the
Okay.
time, the months and weeks in the hospital, I just remember one day my sister was back home. And
Yeah.
now
Yeah.
today she's a paralegal and she works for the state and she's got 4 beautiful boys. So thank
Mhm.
God. It was definitely a traumatic event, but God prevailed and
Brought
she's
her
doing
through.
well. But that led me into this field. It really opened my eyes, and I wanted to be one of those people who brought my sister back home to me.
Wow. Wow. That story gave me goosebumps.
As
Because,
long as it encourages someone out there that you can turn your trauma into blessings and something
yeah,
positive.
yes, indeed. Yes, indeed. Because I was about to say that as a 4-year-old, it was a scary event. It had to be a
Yeah.
very scary event. And that fear at that time still propelled you toward helping and toward being, part of the caring and the bringing back.
And
Awesome.
it's not a surprise that I ended up working in trauma. As a nurse practitioner,
Indeed,
I worked a couple of
indeed.
years in trauma, and these things kind of stay with you, but it
Yeah.
also gave me the confidence that I needed to work in that environment
Mhm.
and to know that, unfavorable outcomes could still become favorable outcomes. But it helped me navigate how to deal with those situations.
That's huge. That's huge. So what were the challenges for you then?
Starting out as a nurse or
Mhm.
currently?
Wherever you want to go.
Yeah, honestly, I think the biggest challenge as a nurse, a new nurse, actually, it still happens to this day.
Mhm.
Patient ratios, nursing and patient ratios to this day, I feel, is what brings down those
Mhm.
HCAP scores that were so big
Mhm.
of now. It brings upon the stress on nurses. It drives nurses away from the bedside.
Yeah.
But we need people at the bedside. Like
Yeah.
everyone can't work in a community. Everyone cannot be a nurse practitioner. If we did, then we would have no RNs.
Mhm.
Um, if we could work on changing patient ratios, and I applaud California because they have that implemented.
Yes. And it
Maybe
works.
not. Right, it works and it allows that nurse to properly give the care to that patient that they deserve.
Hmm.
Right? The patient deserves it and the nurse deserves it. We all got into this field because we care. We want to take care of people. Could you imagine if someone said, okay, you have 5 minutes to take care of this, get it done? But that's what you feel like because you have
That's
8 patients in a 12-hour time frame and take away 30 minutes for your lunch if you get one.
mhm.
And you have to do documentation and you have to do medications. And today, there's so much, everyone's being prescribed so much medication to the point where you're giving 10 and 15 meds, 20 meds on your morning.
Yes.
So the challenge in healthcare in the acute setting, which is where I mainly worked, was that nurse and patient ratio.
Yeah.
And I
Yeah.
feel like I couldn't give my patients what I really wanted to give them. So on a good day, I'd have 5 patients. That day, those days were a breeze. I was
Hmm.
in, I'd take the time and I'd sit with one of my patients.
Hmm.
Sometimes I would be my patient's hair who would let me. Um, if it's a gentleman, sometimes I'll just sit with them and I'll watch sports with them if I had time,
Hmm.
or whatever they wanted to discuss. I enjoyed the holistic approach of
Yeah.
nursing.
Yeah.
And that challenge, if we don't fix it, nursing is going to continue to be as it is. And we're going to keep seeing these discrepancies in
Yeah.
what we see today.
Yeah,
Yeah.
yeah, yeah. And you just talked about the number of meds. And I think people need to understand that that involves more than just giving those meds. Because now you have to observe that patient for the responses to those meds.
Correct. Yeah.
Pretend.
And if they don't know it, sometimes you have to stop and educate them.
And educate, exactly, exactly.
Mhm.
Um, and that in itself takes up a big chunk of,
And
of,
what
of
if
what you
you
do.
didn't know the med? We don't know every single medication out
No,
there.
no.
And we're doing our med checks. We have to go maybe get our pharmacology book and
Hmm.
quickly go back and review it. Oh, this is what this is for. So we had to re-educate ourselves. And then we
Yeah.
have to educate our patient to make sure they
So,
know what the medication
yeah,
is.
yeah.
Yeah.
And all of that, in your 12-hour shift.
You're lucky
So,
if it stays 12 hours. Sometimes it gets pushed to 13 because you're there documenting.
yeah, I know. 12-hour shift, that's kind of like a euphemism for, ain't happening.
Yeah.
So currently, you're still in acute care currently, or you transitioned just to education?
So I've transitioned full time into education, but I still maintain per diem in an acute care
Mm-hmm.
setting as a
Mm-hmm.
hospitalist. I did that for me. My passion is instilling some pride back into the younger generation or to
Mm-hmm.
anyone who wants to get into nursing. People hear that nursing is very difficult, it's hard. And yes, it is a hard area to be in, but when you have the passion for it, you shouldn't let the outside world deter you from joining this field, right? Because it is a rewarding career still. It
Mm-hmm.
is.
Mm-hmm.
And I've started to realize the reward I get from it is by helping. I use my talents. People have told me, you're really good at teaching. Um, and I said, really? Like, yeah, you're really good at teaching. And I kind of just ran with it. And I realized it did bring me joy. I had a different skill set to help people kind of understand how to retain the information,
Mm-hmm.
dissect the information, and to utilize that information, right? Going from theory to practice. I had a niche to kind of help
Yeah,
them.
yeah, yeah,
And
yeah,
I
yeah.
love it. And it works out both ways for me because now having young kids, I no longer have to worry about those very long shifts unless I choose. Like if it's a weekend, maybe I'll pick up a per diem shift. But my
Mhm.
kids have a day off. They'll see me
Yeah,
before or after. It's not like
yeah,
they're going to school. They're missing me all day. By the time I get home, they're in bed.
yeah, yeah,
Yeah.
yeah, yeah.
Yeah.
That's awesome. That's awesome. And so you kind of answered one of the questions that I was going to ask, because I was going to ask you what advice would you give to someone who wants to
Yeah.
to become a
And
nurse.
I say that same thing. Don't let outside influences deter you. If this is
Mhm.
something you're like, nursing is for me, or you have that in you and you want to give it a try, if it's for you, go for it. Find your niche in this field and just give it your all. And make it a journey that to be proud of. I am
Yeah.
so proud of my journey in nursing, like extremely proud. I've done the gamut, but I'm
Yeah.
extremely proud of the journey that I've taken. Um, I was pretty much the first health professional in my family, and because of that, I didn't have a lot of mentors.
Mhm. Mhm.
A lot of mine was self-driven on how to navigate the nursing world. And as I said, I kind of figured out I had a gift to understand it and to now help other people understand it. So if you're new into nursing or you want to get into nursing, it's in your heart, go for it and find a mentor to guide you through it. The first day of class, I say to everyone, are you going to tell me your name, what semester you're in, and what brought you into nursing?
Mhm.
We find a common theme between almost all of us. We've been through something that is related into healthcare. So for me, it
Yeah.
was the trauma of my sister.
Mhm.
The
Mhm.
family member got cancer, or they were sick themselves throughout the years, or they may have sickle cell, or someone they know close had
Mhm.
something that just
Yeah.
really impacted them.
Yeah.
And like you
Yeah.
said, it's not hard to find that niche.
It's not.
Once you're in it and you start to see the different specialties, it will
Yeah.
hit you. You're just like, that's
That's
it.
for me.
That's for me. Yeah. And I
Indeed.
found that in academia. I have found it. Yeah.
Yeah. Yeah. Yeah. What would you say you'd like to see change though?
I think I would want to see more of a camaraderie in nursing.
Mm-hmm.
We've gotten better. I will say that. But when I started, it was still the nurse eats their young thing
Mm-hmm.
going on. And I remember my first year of nursing, there was a nurse, experienced nurse, and she was very mean to me, almost like a bully. And she would be condescending some days, nice, nasty. And I didn't know how to navigate dealing with that. Now, I'm a
Mm-hmm.
new nurse. She's my superior. And when I say superior, she was just like I said, experienced nurse. She wasn't my
Mm-hmm.
manager or anything like that regard.
Mm-hmm.
But there were days I'd have to work with her and I didn't know how to do it. And I felt like for me being a new nurse, she should have opened arms to me. And she should have said, hey, even if you want to call me a name, hey, newbie, whatever you want to, but do it with love. And don't make me feel intimidated or that I don't know
Mm-hmm.
anything
Mm-hmm.
or drive me away from this field because of the tension that may be between myself and a nurse.
Mm-hmm.
And so I think we need to do better and continue to improve on having mentorship, networking abilities, and really being a guide for our newer nurses,
Yeah.
right?
Yeah.
And it kind of makes sense. Here I am in education, I'm bringing in new nurses. So again, there's that life experience that kind of just
Yep.
drives you to where you end up.
Yep. 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 Indeed. Indeed. And so I am going to just shift a little bit because you're an author. You've written children's books.
I have written two children's books. I'm hoping to do a third. My children's books are on co-parenting.
Mm.
And I am a person who takes life experiences and turns them into positivity. And I have a saying, you take your lemons and you turn it to sweet lemonade.
That's what you
And
do. That's what you do.
yeah,
You play the hand you're dealt. Yes.
I do. And so I had separated from my daughter's father. It was a
Mm-hmm.
very difficult and trying time for me. I never wanted that life for me, and most people don't. Some
Mm-hmm.
people are okay with it, but I grew up without my father. I didn't want what people call a broken home today. I don't use that term anymore. I just, instead, I say there are different situations and there are special circumstances that people live in.
Yeah.
In our case, we separated. It was a hard time. I didn't know how to deal with it. And so being me, put it into work or action. And I just one day
Mm-hmm.
it was just doing, and I just started writing. I was like, this will be a cute book. And so I did.
And
And
there
I
you
had
go.
so I had to kind of self-soothe myself
Yeah.
into understanding that, listen, I may not be with her father, but she deserves to be with her father.
Mm-hmm. Mm-hmm.
Because I remember what it felt like to not grow up with my father there all the time. I
Yeah.
knew my father, I had seen him a couple of times, but he was not consistent in my life. And it impacted me. And I didn't want that for her. And her father was very willing to be a part of her life. And I did not need to make our situation difficult. So I said, I'm not the only one going through this. And so I wrote, and it helps other children kind of express or see, hey, I'm not the only kid who goes to my mom's house and or my dad's house, and I have two of everything. And
Yeah.
so
Yeah.
it's called Love Me, Share Me, and it's about co-parenting and sharing that time at both parents' home. And
Mm-hmm.
the second book is a kind of feeds off of the first book, and it's about sharing the family members, their aunts, uncles, grandmas, and grandfather, and how you still have two sides of
Yeah.
your family you get to enjoy time with.
Yeah.
Yeah.
Yeah. Yeah.
Thank you for
And
I'm
you,
proud of that too. Very, very proud of that.
as you should be, as you should be. Because as I'm listening to you talk, the one thing that struck me the most about that whole conversation, and and the co-parenting thing, is that in all of this, your daughter still understands that she is the center of this whole world and still special.
Exactly. And you
So
know what?
special.
Because of that, I feel like my daughter does not suffer from a complex of why aren't my parents together?
Hmm. Yeah.
And now I am married, and my husband, her stepfather, she is very close to him, just as she is close with her own father. And we make it work. We have a beautiful dynamic in our home. It's a blended family. Both my husband has children and I have children, and we are a big blended family now.
And that works.
Yeah.
You know, families are actually like a lot of other things. Um, Even especially we're talking about nursing, even nursing. We come into nursing, for example, and many of us stay in this profession for the whole of our lives, for the whole of our working lives in one area or another. Um, but some of us don't. And
Hmm.
just because they leave or try to move to something else doesn't mean that their contribution was not valuable or that it was not time for them to move. It was
Hmm.
time. That season is finished. For some of us, the season is a lifetime. For some of us, it's just that season is finished and moving to the
Yeah.
next one.
But like nursing does become your family. You spend long hours
You spend
with your
long
your
hours. You spend
colleagues.
long
Huh?
hours.
You spend a
Hmm.
lot of time in school, right? Your classmates from when you were in school, a lot of times you follow them. They care. You
Yeah.
still,
Yeah.
and with the social medias that we have today, it's so easy to just tap back into people. Hey, I remember, and you bring back that family feeling
Yeah.
again.
Hmm.
And I agree with you. Nursing is lifelong. Even if you think that you're sneaking on to something else, you're still an RN.
You're still,
You're still an LP and an RN and AP. You
you're
still
still, you're
are.
still there. You're still
And there
there.
is room for you in every facet of this career. I really feel like there's something for all of us at every stage of our life in nursing.
Yes. Yes, 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 yes. I cannot think. I actually have tried to actually to think of an area where a nurse would not fit. I cannot come up
You
with one.
can. There's so many. We have community, we have law, doctor's offices, schools,
Anywhere,
even
anywhere,
mentorship,
anywhere.
even this,
Yeah, yeah,
even this.
yeah.
You know?
Anywhere, everywhere, everywhere.
Like,
So,
I love this field. I love it. I
so as we're
do.
talking about nurses and nursing, though, and how much it requires from us, and how much it gives to us, what would you say if you could tell me in one word? What do you say is would you say is the most essential quality of a nurse to you?
I'm sure so many people, I hope a lot of people feel this way, that component of care, compassion. If you don't have that soul component of just you care, then you wouldn't be so involved in, let me rewind that. When you care about something, you're giving a lot of yourself to it. You're going to make sure you don't fail it.
Mm-hmm.
That thing can impede upon it. You'll make sure that nothing will interfere with it or nothing negative. When you care, you consider it, you think about it often, you you think twice before you do something that's going to affect it.
Gotcha.
So
Mm-hmm.
that can go across the with our patients, with ourselves, a medication error, vital signs, our colleagues. When you care, you will stop anything from impeding upon it.
Yeah.
So anything
Yeah.
else, anything else, there's a chance that you may dwindle from it. But when you care, you're always considering it. And I
Yeah.
think that's the most
Yeah.
important quality we need. Even with students, right? If I
Yeah.
didn't care about my students, they could be flunking. I would just be, but that's not intentional. We care too much.
You care too much. You care too
Yeah.
much for that to happen. And you understand what's at stake.
Right.
And you can't just let that
And that's the word, that's the word I needed right there. You know what's at stake. Yeah.
mhm, yeah,
Hmm.
understand what's at stake. So we talk a lot about burnout and stuff like that. What do you
Yeah.
do to care for you?
Oh, I get very selfish when it comes to that. I'm okay to say it. And why? Because I've learned over the years, if I don't take care of me, and I'll talk in a third person, if Clarese doesn't take care of Clarese, I affect my care
Yeah.
that I give to everyone else. And whether that is an emotional response, a physical response, if I don't take care of me, I'm going to affect that across the board. And so, what I like to do is I find what makes me happy, what makes me sad, what makes me peaceful, what makes me feel at distress. You have to be self-aware of yourself. And when you can pinpoint, hey, today I'm feeling sad. I don't want this to affect anything. Let me do something that's going to self-soothe that. And for me, I binge watch television when I get the time, or I'll
Mhm.
read a book. I will lay out in my hammock. Or sometimes I just play music. And when I know I need that, and my husband knows, babe, I'm just gonna watch my TV show all night long. He goes, oh, it's
Okay.
one of those nights. One of those nights. And it makes me feel at peace. Because when I get to watch TV, I don't have to think about anything else. I'm just watching what's on the television.
Yeah. Yeah.
Yeah.
I get that. I get that.
Self-care involves being aware. Oh,
It
that's a good slogan.
it is actually.
That's a good slogan. I gotta
It
trademark it.
is. Self-care involves being aware, but you're right. You actually have to be aware because, you know, when we go through some kind of motion that we look at as self-care,
Hmm.
right? We migrate to the things that a lot of people say are self-care. We talk about getting our nails done, on our hair done, on and all of that. And all of that is good,
Right?
but it may not be what I need.
Uh-huh. Yep. What is it
So
that you need? And like I said, if I'm feeling sad, I'm gonna need something that where I can self-soothe. and
Yeah.
then bring yourself back into that happy.
Yeah. Yeah.
And
Yeah. Which is absolutely essential, and which is something that as an educator, I'm going to ask you, as an educator, are you noticing that that component is coming into the way we educate nurses? Because, as a student, certainly no one ever mentioned self-care to me. And I suspect that had I mentioned it, people would look at me as though I'm crazy. This was,
what? What is that?
what? What? Where do you fit in the picture?
Mm.
You're here to do the work. What do you mean by self-care? So are we helping our nurses coming along in their education
I
to
think we're
see that
getting
they
better
matter?
at it. There has been a big push for mental health since COVID, and we
Mm-hmm.
all were affected, right? And if you were lucky enough to know how to self-soothe yourself or to get yourself through that, you came out okay. But there were people who didn't, and they didn't know how to do it. And we recognize that in our students. A lot of them are very anxious,
Mm-hmm.
um, overwhelmed, not to mention they have a broader scale of something that it's constantly being planted in their head. Social media. The
Mm-hmm.
feed is always, they're just scrolling and scrolling, and they're taking that information in
Mm-hmm.
and they are using it and they're reacting on it. And they're thinking everyone else's world is so grand and so beautiful because it's on social media. And here I am, I'm stuck in nursing school, or I have to work really hard and it's stressful because I have this paper and that paper, da 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 da. And they're not realizing that what you see on social media may not be true, may not be realistic. And you spending your time
Yeah.
comparing life to other people will only make you feel worse.
Yeah. Yeah.
So, and then with COVID, there was isolation. People
I-
went inward.
Yeah.
They didn't have anyone to be around or talk to. And so now they think they have to navigate these feelings and emotions on their own.
Yeah. And some of that isolation, just like long COVID, is lingering.
Yes.
Some people just do not know how to re-assimilate. And I get that.
They
I
won't
get
rule
that.
it out, their fear of being a burden, or because
Yeah.
COVID has kind of slowed down, they feel like if they mention it, people won't believe them.
Yeah.
And let's not
And let's not
forget,
forget.
when COVID actually happened, there were people out there who thought it was all fake.
Yeah.
No, you didn't see the bodies in the hospital. You didn't see the
Yeah.
people in the ICUs passing away
Yeah.
minute after minute. So a lot of people, like you said, they didn't know how to reassimilate and they still don't reach out. They're
Yeah.
just isolated.
Yeah. 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 And our lives make it easy to stay in and kind of like harder actually to venture out. There was a time when you had to venture out. You had to go to the grocery store. You had to, right? I don't
Yeah.
have to move.
No,
I do not
everything's
have
right
to
at your
move.
fingertips.
Yeah,
Everything is
right?
right. People don't go to the mall anymore to go shopping. You
No,
realize it's not just shopping that you're doing. You are spending time with people that you love,
yeah,
you
yeah.
know,
You
eh,
spent time with people, you walked out, you saw other people,
exercising.
you saw all kinds of things. You don't have
Yeah,
to. And
it's
that
so
makes it
funny you bring this up because my husband, he wants some new articles of clothing for the winter. And I said, honey, we could just go to the mall. He was like, oh, the mall? I could just go it on my phone. I said, the reason there's a mall is so we can go see it in person. It's just completely flabbergasted that I mentioned going to the mall like it's some ancient thing.
that is from 1990s.
I'm like, there was once a time that the mall was the it thing to do. That was the thing to do.
Yeah.
It's Friday night, let's go to the mall. Like,
Let's go to the mall.
so I agree with you. People don't realize they take a lot away from themselves when you stay stuck to your devices. And
Yeah.
it's okay. Like if you have no choice, you're at home. But if you have the ability, why not?
Why not indeed? Why not indeed? So one of the things you told me a little while ago was that you're proud of your journey.
Mhm.
So I have two things that come off of that. One is I want to know what you see as your greatest achievement so far. And the other thing I want is what is your big vision for you going forward?
Oh, my greatest achievement. Whew. I think staying active in this field. I am actively involved through different organizations. Like I'm a
Yeah.
part of Chi Phi, the professional nursing sorority, being a part of the American Nurses Association, the New Jersey State Nurses Association, part
Hmm.
of that, and giving my time back into this field. It wasn't until actually getting my doctorate that I found a little excitement in research. Because before I was never interested, but I've really come to enjoy it, and I think I may kind of jump into that a little later in the
Hmm.
next couple of years. But I think staying involved is one of my greatest achievements in this field because I'm going to help grow the field, right? And you did mention that earlier.
Yeah.
Just because you're in it for a short time doesn't mean you did not give to this
Yeah.
field.
Yeah.
And
Yeah.
um, doing so, I think by staying abreast of the advances, I'm also helping my students who are our future
Yes.
providers, right?
Yep.
And
Hmm.
people ask, why would you go to teach? I said, because one day they're going to be taking care of me. And I want someone smart and prudent in there. And if I see my patient, I mean, if I see my student walk in my room one day, I'm like, oh, at least I know you
Yes.
know what you're doing.
Indeed.
So
I think
that,
sometimes we forget that, you know.
yeah, this
Yeah.
these are our future providers,
These are our
whether we
future
like it or
providers.
not. And we have to give back into that. We
Yeah.
have to foster that and help them grow. And the second question you asked
The second question I had asked was, what is your big vision for you? And that was, I guess.
me,
Mhm.
um, I think not, this is way too soon. I do want to change some of the culture of our nursing schools. I want to kind of help our students see nursing how I see it. It's a journey. It's a long haul.
Mhm.
And I want to get them excited early. And when I say excited early, I want to go into the high schools and recruit for nursing.
Yeah.
And I want people to stay passionate throughout and have long-term retention. So like kind of how we also discussed, there is a facet of this career for everyone at
Yeah.
every age. Even
Yeah.
if you're 75, you could be a mentor to
Hmm.
nurses. You could educate people or give speeches, and there's so much you can still do.
There's so much you can do.
Right. You can provide your evidence-based practices and experiences that we can learn from.
Yeah.
So my bigger vision is ultimately I may want to become, I don't know, a dean of a nursing school. I don't know. I'll
Just
speak
go
it
for it.
speak it into
Plant
existence.
that
I trust God's
seed.
journey.
Plant that seed. Water it. Watch it grow.
Yeah. Way too soon right now. I really enjoy where I'm at. But I do think my long haul will be I want to change cultures of nursing schools and change the curriculum to embody the holistic and long-term journey.
That's okay. That is way too soon. That's like, that's how trees grow. They don't like
Yes, you're right.
grow the big trees overnight.
That's a good analogy. I like that. I might have to use that one with my kids. Trees don't become big trees overnight.
Nope. Thank you so, so very, very much for this conversation. I have truly enjoyed talking to you
Thank
today.
you.
Is there,
Likewise.
is there any last words you want to leave us with?
I just want to say, always trust God. Um, your journey is not just your journey. God has a
Mhm.
vision and a path for you, and He does not do anything to harm us. He does not want us hurting, and um, His goal for you is always to have success. So wherever you are in your journey or whatever is going on, even if you feel like it's a delay, it's not. It's not a no, it's just not yet.
So that's not yet. It's just not yet. Thank you so very much for that. Thank you. I appreciate it.
Thank you.